The issue of physician assistant specialty certification and recognition is a very complex one. PAs are required to take a recertification exam every 6 years on primary care medicine. With nearly 70% of all PAs working in 60 different specialties, many PAs question whether this test is an effective tool to predict their medical competence, while specialty PAs continue searching for a way to show their clinical expertise. The future of PA certification and recognition. You're listening to ReachMD XM160, the channel for medical professionals. Welcome to the Clinicians Roundtable. I'm PA Lisa D'Andrea Lenell, your host, and with me today is Janet Lathrop, President and CEO of the National Commission on Certification of Physician Assistants. Today we are discussing the Physician Assistant Specialty Certification. Hi Janet, welcome to ReachMD.
Hi Lisa, thanks so much for having me.
Janet, let's start by defining the difference between specialty certification and specialty recognition.
The difference between specialty certification and specialty recognition, in my mind, I guess, is a difference of what you're calling it. If we go with recognition, it's similar to our surgery exam, where we used to award a certificate of recognition that didn't have an expiration date, where in my mind, certification would be more like a high-stakes credential.
In early February, the National Commission on Certification of Physician Assistants issued a public statement assuring PAs and PA specialty organizations that it is continuing to develop some sort of credentialing process for PAs and specialties. And that was awfully vague. What does that mean for a PA who's currently working in a specialty?
Well, I think it's purposely vague at this point, simply because this is very much a work in progress. But for the PA working in a specialty, the PA, particularly the PA who's being asked for documentation of qualifications to work in that specialty, this to me says, we're in your corner. We understand that you may be facing a challenge and that your national certifying board is working to figure out the best way to help you.
Is the NCCPA working on a plan for specialty certification, recognition, or both?
Exactly. What form of the new specialty credential will take is still up for discussion within our organization. We have a task force that's looking at this issue, and hopefully, if they carry out their charge, we will have an answer by the end of this year.
Do you think that any specialty changes will have an influence on the current generalist PA certification process?
No, I don't. I believe that the generalist certification process is the bedrock of the physician assistant profession, and we will work very hard to maintain that generalist nature of our certification.
And is NCCPA working with the AAPA on this issue?
Yes, we are absolutely working with them. They actually have a senior staff member, Greg Thomas, who's working with our committee. He's part of our discussions. He's at every meeting. We also have listened to as resources and other, people in a special area of expertise. We've listened to them as a work group. We've had them join the work group and provide us with additional information. We've had a very open dialogue with Phil Lineweber, the AAPA CEO, and other leaders about what we're doing and thinking in this area.
So several PA specialty groups, such as the cardiovascular PAs, have a very strong opinion. They've been under considerable pressure by state regulatory agencies and the hospitals they work with to prove competence in their field. And how does the NCCPA support them?
For me, that's really what this is about, to a very large degree. In addition to working with AAPA, we've also spent a considerable amount of time over the last 3 years talking with the cardiovascular PAs and a number of others who have the same kind of interest in our work in this area. Back in 2006, we brought PA and physician groups together to meet with us, and on more than one occasion, we've traveled to meet with other groups individually. We're trying to seek an understanding of the needs of and challenges facing the PAs in the different specialties. Will there be a solution that makes everyone happy? Of course not. There's always the public interest to keep in mind, and we'll be working with as many PAs and physician organizations as we can to make sure that the process or processes we developed are as relevant, meaningful, appropriate, and affordable as we can make them.
So many of the specialty organizations have worked with their hospitals, and they've started creating their own competence procedures. And it seems like the PA profession is always moving forward, and we're waiting for our supporting organizations to start helping them. Why do you suppose that this is taking so long? It seems like the CVPAs have been discussing this for a number of years now.
You're right, and they have. And I can only speak for NCCPA. But for many years, our position was that we didn't want to be a force driving the course of the profession. Instead, we wanted to wait for the profession to reach agreement, on what it wanted, particularly in the area of specialty certification or recognition. And with it being such a complex issue, this has been difficult for us. A few years ago, though, we reevaluated the issue from the perspective that our primary stakeholder, the group we serve above all others, which is the public, we looked at it from that perspective. And though it's still just as complex, once we started viewing it through the public's eye, it became clear that we couldn't just continue to wait for the members of the profession to reach an agreement, that we had to take the lead on this again. But again, we are doing it in a very inclusive way.
And what is the role for the NCCPA in that situation? You guys aren't really the decision makers. You monitor the PA profession testing and credentialing. So is it the AAPA that's supposed to make the decision and then bring it to you to monitor it or come up with a plan to monitor it?
No, I do think that that's the NCCPA's role, I guess, as the certifying body for the profession. Certainly we want to listen to I believe that the professional organization knows best what's good for the profession, or at least it should. And, they hear from the members, and I think we have to take information from all different sources, the AAPA, all the individual specialty groups, assess it, and then make a determination of what is best for the PA to some degree, but again, more for our responsibility to the public and the patients.
So who do you think is pushing for this change? Is it the PAs? Is it the public, the hospitals, the physicians?
I think it's all of them to varying degrees. Some PAs are asking for help. They're apparently losing job opportunities because they don't have a piece of paper or something that says they can perform specialty work. The public, principally through consumer interest groups, has challenged old ideas about quality assurance and competence in healthcare. There seems to be a swell of interest in more rather than less these days.
And how much of this do you think has to do with hospital privileges?
Hospital privileging is definitely a big part of the equation here. It's a great deal of the challenge to PA credentials is coming into play. It's not just in the hospitals. And again, the question of exactly what form this credential will take and what it will be called is still an active discussion.
If you're just joining us, you're listening to the Clinicians Roundtable on ReachMD XM 160, the channel for medical professionals. I'm PA Lisa D'Andrea Lenell, and I'm speaking with Janet Lathrop, President and CEO for the National Commission on Certification of Physician Assistants. Today we are discussing PA specialty certification. So Janet, specialty recognition appears to be the middle ground. Do you think that's where the PA profession is headed first?
I don't know. I think that specialty recognition will be sufficient possibly for hospitals and regulatory agencies. We know that specialty certification is seen for the most part as a higher standard or a different standard. So one of the questions I think we have to answer is whether taking the half step and doing what might be good enough for some for now is the best way to go. We, again, haven't reached a conclusion on that yet as well.
If you do specialty recognition, is that sufficient for the regulators and the hospitals?
I certainly hope so, because that's one of the biggest reasons we're doing it. I would have to believe it would be.
So one of the largest cries we hear from PAs regarding credentialing is that it will impair the PA's ability to move from specialty to specialty. Do you see that as a problem?
I suppose it could be. But in my mind, it could also work the other way. It's easy to imagine that having a specialty credential in one's pocket would make it easier to change specialties. Yes, you'd have to jump through some hurdles to get the credential, but that could be the easiest way for someone to make a change.
Let's talk about the current testing. New graduates are entering specialties straight out of school, and they're never working a day in a primary care setting. I hear often them saying, is it fair? Does it make sense for them to take a generalist exam every 6 years?
Yeah, and we probably even hear it more from the practicing PA who's been delivering babies for 25 years, how unfair it is to go back and learn derm or, just to remember to have to reteach themselves. But the reality is that the generalist exam will always be the bedrock to PA certification. Maybe one should never say always, but I can't foresee a time when all PAs won't take a generalist exam.
Well, if specialty certification does come about, what kind of consequences do you think this would have on the PA profession?
Well, obviously, from our perspective, we see this as a positive thing. But, we believe that it better positions PAs as a key part of the answer to the shortage of providers that's plaguing so many corners of the U.S. healthcare system. We see PAs as an answer to the need for affordable, accessible, high-quality healthcare. and that we can equip them with the credentials they need to work in both primary care and specialty areas. That's very critical. We see it as a very critical job for our NCCPA.
Tell us about how the certification process has changed over the years and your involvement in those changes.
Well, the certification, for the most part, is kind of stayed the same. I mean, we've always had the exam, we've always had the CME, and probably the changes, other than the elimination of Pathway 2, which was our alternative to taking the proctored PANRE exam, that'll be eliminated, the last administration in 2010, probably have been the most significant changes. As the board continue to look at maintenance of certification and work the competencies, and in general, it is possible that in the future we may see some changes to the process.
Tell us about the practice-focused exam.
The Practice Focus exam is rolled out this year for the first time. March was the first month we gave it, and it's an additional practice focus areas. I think we have 3 that I should know these, that we added on as an option for the recertifying PA to take. So in other words, they would take their generalist piece, and then they would be able to add on more generalist questions in a practice-focused area. The idea being if they're in surgery, that, adding a percentage of extra surgery questions would help them take a more practice-focused examination.
And then would you get any kind of recognition for that extra practice-focused portion?
No, as of right now, it's general certification with the generalist C.
So what would be the benefit of adding on the extra portion?
I guess stomach comfort. One thing I can see as a PA. I mean, I'd rather take more questions in my area and feel that I have a better chance of passing the exam. Probably is the biggest plus for PAs.
So there are still many people at PAs that don't really understand the role of the NCCPA. Could you just give us a little bit of a history and explain what your role really is?
Our role goes back to our mission, really, which is to ensure that practicing PAs meet standard acceptable levels of knowledge. I think we are kind of the de facto licensing exam because our initial examination, the PANS, is required in all states for licensure. And also relicensure, really, in 26 states. So I guess I see us as kind of the regulating organization for the profession.
And where did the NCCPA come into the PA profession?
Back in the 1970s, we were originally formed and worked kind of under the National Board of Medical Examiners, and in the late 70s incorporated and branched out on our own.
How have things changed?
Well, they've changed a lot, in my opinion, from an operational perspective. We have, for 30-some-odd years, we relied on the National Board of Medical Examiners to help us develop and administer our examinations. And recently, about 2 years ago, we brought everything in-house. So now we do everything. We do our own development of our blueprints, the practice analysis, the blueprints, our test questions. We house them here. We create our forms here, and we administer our tests through the Pearson VUE sites. So we've grown significantly. Well, most of our products really haven't changed. We have grown operationally significantly over the last 10 years.
Well, I think many people don't realize the commitment that the NCCPA really has to the PA profession. And I just wanted to bring up that in 2007, the NCCPA received the Georgia Oglethorpe Award for Performance Excellence. And I'd like to give you the opportunity to tell the listeners what that means.
Well, thank you, because that is so exciting. And this was our desire to have a third party recognize all of our hard work. For so long, for the last 5 to 7 years, we had implemented process improvement, tried to do things differently, tried to save money, tried to cut back so that we wouldn't have to raise fees. We haven't raised fees in almost 10 years. And we were able to do that by just refining our processes through the Six Sigma process. And we realized, boy, we've really done amazing things here, but we can say it all we want in our newsletters and to PAs. And, it would be so much better to have a third party come along and kind of validate what we've done. So we were actually going to go for the Baldrige Award, which is the National Award of Quality Excellence. And we realized that the better step would be to get your state award first. So we applied for that, as you said, in 2007, and we won it. And we were the first organization ever to win on their first try. And I think the second nonprofit. And that felt good. And now, actually, we'd like to go for the Baldrige. It's kind of on the horizon for us. So we'll see what happens with that.
Well, thank you, Janet, for coming on the show.
Thanks, Lisa. I enjoyed it.
I'm PA Lisa D'Andrea Lenell, and you've been listening to the Clinicians Roundtable on ReachMD XM160, the channel for medical professionals. Please visit our website at reachmd.com, which features our entire library through on-demand podcasts. And thanks for listening.